Well, good evening and welcome to the COVID-19 pandemic update. I'm Kayode Okikelu. First, the highlights. Governor of Ekiti State orders the suspension of the Provost of the College of Health Sciences and Technology, Ijero Ekiti, over fumigation gone wrong. Orders investigation. Imo State postpones administration of second jabs due to security breaches in the state as it hopes to complete the exercise within the efficacy window. And the United Kingdom approves Johnson & Johnson single-dose vaccine, says it has met expected safety standards. Well, only 12 states and the FCT have begun administering the second dose of the AstraZeneca vaccine. That's according to the National Primary Healthcare Development Agency. Now, as Nigeria tries to make do with the 4 million doses it has received so far, which will only vaccinate 1% of the population, the World Health Organization continues to encourage world leaders to support a massive push to vaccinate at least 10% of the population of every country by September, and 30% by the end of the year. Well, Nigeria will need to vaccinate 60 million people in 7 months to reach this target. In the meantime, here's how far we have come in our COVID-19 response.
Since the outbreak of the COVID-19 pandemic over a year ago, yesterday was the first time Children's Day was celebrated and the first Children's Day celebration with the use of masks and social distancing. It was also an opportunity for the Jigawa State government to give the first address on COVID-19 directed specifically towards children.
Even though we think the COVID-19 is over, it is still not over. We can still contract it. So we should be observing the social distances. We should be using our face masks and we should be cleaning our hands very regularly.
Meanwhile, the NCDC has reported 45 new cases from 5 states. Lagos had 27 new cases, Rivers 14 and Kaduna 2. Jigawa and Ekiti states had 1 new case each. The latest update includes 0 cases from Plateau, Nasarawa, Kano, Sokoto, Osun, Ondo, Ogun and Oyo, as well as the FCT. The new cases have raised the total number of confirmed cases in Nigeria to 166,191. 6 people have been discharged in the last 24 hours, increasing the number of recoveries to 156,535. There were no casualties in the last 24 hours, which leaves the fatality toll at 2,071. Over 1.9 million eligible Nigerians have been vaccinated with the first dose of the Oxford AstraZeneca vaccine, while 22,162 of those vaccinated with the first dose have now received their second dose. In the second phase of the exercise, Katsina State has the most vaccinated people with over 5,000 shots given. Benue has administered over 4,000 jabs. The National Primary Healthcare Development Agency is advising Nigerians to bring their vaccination cards along in order to be given their second dose of the Oxford AstraZeneca COVID-19 vaccine. Globally, more than 169 million confirmed cases and over 3.5 million COVID-19 related deaths have been reported.
Well, yesterday we brought you the story of the COVID-19 fumigation that turned harmful for students at the College of Health Sciences and Technology, Ijero Ekiti, Ekiti State. Well, we have an update. Governor Kayode has directed the suspension of the provost of the college, Dr. Cecilia Adebayo, and set up a panel of investigation headed by the Commissioner for Health to unravel the incident within 2 weeks. The controversial fumigation initially landed at least 100 students of the institution in the hospital, out of which more than 60 were later discharged the same day. A State Ministry of Health source says, though about 5 patients are still on admission, they are all clinically stable and will hopefully be discharged soon. The officials of the Federal Fire Service that carried out the fumigation have also been directed to report back to their office in Abuja. And also across River State, where frontline health workers have received their booster shots. So flagging off the exercise at the Ediba Primary Healthcare Center, Calabar, the State Commissioner for Health, Dr. Betta Edu, says COVID-19 is still considered a pandemic, with new strains resulting in high mortality across the globe. She gave the government's commitment to meet the estimated target population during the second phase, considering the fact that the state exceeded its target in the first phase by 17%.
With 117% coverage, we were able to reach out to everyone in the first dose that were eligible for it under the target population we had in our micro planning. And as we're going into the second dose, we would be ensuring that everyone who had the first dose will be back to get the second dose. More importantly is the fact that Cross River State was also able to vaccinate refugees in our dear state. We have over 37,000 refugees from Cameroon in Cross River State, and we were able to cover them as part of the first dose exercise. For this second COVID-19 vaccination exercise, we also will be covering other Cross Riverians and the refugees. For us, it's the ability to ensure equity in vaccine distribution and universal access to these vaccines.
And now to Imo State, where the government has allayed the fears of residents over the recent postponement of the second phase of the COVID-19 vaccination due to some security breaches in the state. The Chairman Surveillance Committee of the Imo State COVID-19 Task Force and Chairman Imo State Specialist Hospital Management Board, Dr. Success Prosper Oyaga, says the second dose of the vaccination is necessary, quite all right, for everyone that has gotten the first jab, but security of lives of the people is also vital. He says as long as the postponement won't take too long, the time difference between the first and the second jab is quite negligible.
It is going to help potentiate the strength of the vaccine in the body, as in the response of the vaccine of the person to the coronavirus. Now, but you know, with the issue of security is a general issue that we have in the states, and everybody needs to be careful. As we also need to take this vaccine, we also need to take our security very necessary. So the postponement will not take long. It's just for us to see the level at which these security issues will be and how to tackle it. As long as it doesn't take too long a time, the second jab will go on with the first one. It doesn't, the time limit is quite negligible.
So for a broader perspective of the COVID-19 response in Imo State, Professor Maurice Ewe, the chairman of the State COVID-19 Task Force, joins us on the program this evening. He's also a professor of pharmacognosy. It's good to have you on the program, Prof. Well, from a general view now, how much would you say the security situation in Imo State has affected the COVID's response, not just vaccination alone this time around?
Yes, it has posed a special problem to the state, but just like Dr. Prosper said, we are taking the issue of the security first and foremost before considering the task force job of protecting Imo State against COVID-19. Luckily, we only have 2 active cases. I think they will soon go off the clinic. We don't have any new cases coming in, and hopefully people are obeying the rules, but the security situation is really impeding the work we are doing. So far, so good. We have people at any given time, if there's any shots or any shout, they won't even know why people are running, people start running. But luckily, the state government is equal to the task. There are some normalcy now restored. People are going about their normal businesses, and it has not really affected the preparedness of the state to tackle the situations as they come. As I said, the curve is already flattened, but we are still urging people to obey those 3 non-pharmaceutical guidelines, namely to keep their face masks whenever they're in public or whenever they're outside their homes, or when they're receiving visitors, they should wear their face masks. They should wash their hands with soap and water, and if there's no soap and water, to use sanitizers. And much more importantly, because of what's happening in India, they should try to maintain social distance for people they don't know, because you don't know who has gone where. And that is actually the only area we have great concern is what happens when people travel from outside our state and outside our country to Nigeria. We don't know what they are carrying with them.
You know, I'm sure you've been watching the trends with vaccination supply in Nigeria. Well, we're not exactly sure when we'll get the next shipment from COVAX, or is it Pfizer or any other manufacturer. So, I mean, looking at the trends and what might possibly happen, don't forget the WHO says the target is 30% of the population by the end of the year. We're not sure when we'll get that next shipment. How do you see this playing out for Nigeria?
I think so far Nigeria is doing well. The NCDC and the primary health people are trying to meet the target, and we are following up what they are doing. But what is very important, regardless of the vaccination, people should not let their guards down, because we don't know the strengths out there, whether the vaccines will be able to meet the challenge from those strains, the new strains that are coming up. So people should not let their guards down. But we are also lucky in this country that there's a whole lot of natural antibody being formed because of contact with the coronavirus. I think the level of antibody that is formed by contact, unknowingly having the contact with the virus, and the antibody studies that are going on is very encouraging, that a lot of people are building natural immunity to it, and then that will also help. The vaccination, I think, is going well. Since we don't manufacture it, we have to wait and get it from outside the country. I think this is a lesson for us now, that we have to be prepared, not to be dependent on other nations for such very vital things for healthcare, like vaccines and so on.
You know, while that conversation is ongoing, there's the talk about looking inwards as well. I know you're a champion of sorts for herbal remedies to COVID-19. If you could just give us an update. I know you've done some work, or you're doing some work. How is the clinical trial approval process generally of your formulation and others? How is it going? Because at some point you said that we could be faster with this process.
It could be faster. We are doing well. The trial that we are doing at the University of Lagos is proceeding well. It's coming to an end. But regardless of that, people are taking the preparations on their own, because once the NAFDAC approves a product for clinical trial, that means that it is at least good enough for human consumption. And that is what is happening, that people are taking the IHP detox on their own. But we even have a better good news. We have tested a known anti-malaria drug called artemisinin. We escalated the dose to 500 milligrams, and the result of a multinational clinical trial is very encouraging, that we can then look back and then think of reformulating a better strategy. Luckily, the study is being done concurrently in India, and we're also starting our own here in Nigeria, University of Abuja. We are waiting for NAFDAC to give us the nod. We have been corresponding with them. They raised some questions which we're answering. The entire thing is that this is a coronavirus. COVID-19 seems new, but coronavirus is not new. So we are trying to deploy the same tactical clinical method that was used for the other coronaviruses in the past for this particular virus. And we are better prepared now, and the product that we have worked, and then we don't have to be able to wait for other people to give us a treatment. And this is one big lesson we have learned, that it is good to have our research and development up and going, since we don't know what is out there. And in this particular case, the IHP detox is just a tea, but the other one that we are doing through the University of Abuja, which we have not started the clinical trials, we are going to start pretty soon, is on an oral dosage form based on a drug called artemisinin, which is already in your anti-malaria product that you are using currently.
Well, Professor Maurice Ewe, it's been great speaking with you on this topic. Thank you so much for sharing your thoughts.
Thank you. It's a pleasure.
We'll go on a break now, and when we return, we'll tell you about a single-dose vaccine that has just been approved outside Nigeria. Do join us again. You're welcome back. Talk about another layer of security for security operatives, as the Katsina State Police Commissioner Sanusi Buba encourages the police and other security personnel to embrace the COVID-19 vaccine in order to stay safe and boost their immune system. The police commissioner believes the best way to encourage governments for delivering the vaccines is to embrace the rollout for security agencies and the good people of the state alike. He was speaking shortly after taking his second jab of the vaccine in his office at the command headquarters in Katsina.
It's a very, very dangerous pandemic that nobody can afford to toy with. And Nigeria, indeed, Katsina in particular, cannot be an exception to the international outcry over there on the imperatives of having these vaccines. So I want to use this opportunity to call on all and sundry, not only my police personnel and other security agencies, but also the good people of Katsina State in its entirety to embrace this federal government gesture. In some other climes, people find it extremely difficult to get this kind of opportunity. But the federal government has gone extra mile alongside with the state government to give people this opportunity of having access to these vaccines, and people should not, at least for once, lose this opportunity.
And now to news just in. As part of the continued response to the COVID-19 pandemic, the Federal Ministry of Health, through its agencies, the National Primary Healthcare Development Agency and the Nigeria Center for Disease Control, is implementing a massive distribution of personal protective equipment to health workers in primary healthcare centers across Nigeria. Well, this is supported by health sector partners Gavi, the Vaccine Alliance and UNICEF. The federal government of Nigeria and its partners recognize the need for ensuring continuity of health services. And despite the COVID-19 pandemic and in recognition of risks health workers face in providing care to patients, these PPEs are being provided to ensure that they are properly protected in the line of duty. The items being distributed include thousands of goggles, masks, gloves, gowns, boots, waste bins, hand sanitizers, chlorine, and other commodities. These will be distributed to selected PHCs across all 774 local government areas in Nigeria. The federal government of Nigeria remains grateful to its partners, especially Gavi, the Vaccine Alliance, and UNICEF for the collaboration in ensuring the protection of health workers. And outside Nigeria, students in Germany from the age of 12 will have the opportunity to be vaccinated beginning early next month. Now, the result of a Thursday meeting between Chancellor Angela Merkel and state leaders over what's become an increasingly controversial topic in the country. Parents and students have pushed for more rapid access to vaccines with an eye toward the coming school year. But health officials have warned about moving too fast. Well, this is a new terrain, so to speak, and DW correspondent Stephen Bursley joins us from Berlin to walk us through it. Well, Stephen, what does Thursday's decision mean for students and parents alike?
What it means is that beginning June 7th, that they will be able to participate with other Germans who have not been received priority status, that they will also be able to get in line basically for a vaccine. That is provided, of course, that the EU medicines regulator approves BioNTech Pfizer, that vaccine, for students from the age of 12. That is expected to happen on Friday. And if that's the case, then again, they will join a larger amount of Germans who were not able to get a vaccine appointment to this date because they haven't met one of the priority requirements, such as being elderly, such as having a pre-existing condition. Beginning June 7th, they will all be able to try and get an appointment. And that, of course, depends on the supply of vaccine that's out there. Now, what this doesn't mean, of course, is that there will not be a specific set of vaccines set aside just for students from the age of 12. There will not be a specific government-run campaign to get them vaccinated, and there's already some criticism from teachers and students about that.
So I'm wondering now, Stephen, why has this subject of student vaccination been so controversial?
Well, it's been controversial because there's a wide understanding here in Germany that really students have had a very difficult time during the pandemic. We have to keep in mind that presence learning, that is, that the time spent at school has been very patchy throughout the past year, and for some kids, almost non-existent. That means that they've had to do distance learning at home. That brings a lot of troubles, as some of our viewers may be aware of from their own personal experience. You know, standing over a child, helping them learn, helping them navigate the system. Some just don't do it that well. There are others who may have behavioral issues that need to be addressed at school, and there are others, of course, many students who just want the socialization of being at school. So it's been a very, very difficult time for this group of students, and of course for their parents as well, who have to pull away from their activities, otherwise their work, to be able to help their kids get through this time. So there is an understanding that it's been difficult, and that's why there's been such a push recently by parents and students and teachers alike to say, hey, let's make this group a priority, especially with the new school year coming. Politicians have generally come on board. The health minister has said that he agrees that this should be a priority. The education minister has also said she absolutely believes this should be a priority, that she could envision, in fact, classes going to get vaccinated at a time together, that schools could really set up their own campaigns once they're able to get kids of this age group vaccinated. Now, there's been a backlash against that. Health officials, for example, here in Germany have said, hey, wait, we're the ones who give a recommendation about what age anyone, frankly, should be vaccinated at, how safe a vaccination is. Now, of course, there's a process through which the EU says that we approve a vaccine, but there's also the process through which national governments then say our own experts look at it and decide whether it's safe.
Well, quite interesting. But let's zoom out now, Stephen. How is Germany's progress on vaccination looking?
Otherwise, it's been mostly positive news. It really has. You know, the vaccination campaign has come into momentum in the past 4 to 5 weeks or so. The optimism here is really lifted. 41% of the German population has received a vaccination, a first vaccination so far. So they've made up for a lot of lost ground, a lot of delays that happened earlier, and there's been a much greater supply of the vaccine out there. There are a lot of questions around this lifting of priority access, especially if teenagers are going to really get into the process here as well. Will there be enough for those who may have still be at higher risk? For example, right now we're probably, I think, on the 60-year-olds who are really still trying to get their vaccinations. Teachers, in fact, only 80% of German teachers have actually received a vaccination. So there's some groups that still haven't finished their first vaccinations.
Well, great job, Stephen. Thanks for your time. Also outside the country, a single-dose COVID vaccine made by Janssen has been approved for use in the UK by medicines regulator. The vaccine was 85% effective in stopping severe illness from COVID-19 in trials and has met expected safety standards. It will be the fourth vaccine to be used in the UK to protect against COVID-19. Oh, and by the way, Janssen is owned by Johnson & Johnson.
J&J's vaccine is already approved in the United States and European Union, where reports of rare blood clots are being reviewed. The shot uses the similar viral vector technology to the Oxford AstraZeneca vaccine, where similar clots have been reported. Britain has advised that under 40s are offered an alternative to the AstraZeneca shot, and the government says that vaccine advisors, the Joint Committee on Vaccination and Immunization, will also advise on how J&J's shot is used. Greece presented its COVID-19 digital travel certificate on Friday, saying it is ready to use it before its EU-wide launch on July the 1st. Greece is one of the early advocates of a certificate that would ease European Union travel curbs and help pull the country's economy from recession by lifting tourism revenues.
The EU digital COVID certificate is nothing more than a fast travel lane. It will make travel much easier, especially during the summer, particularly, again, let me repeat how important this is for us.
The European Council and Parliament last week reached a deal on the digital green certificate following a rapid pickup of vaccinations, allowing widespread lifting of coronavirus curbs. In Asia, Japan on Friday extended a state of emergency in Tokyo and other areas by about 3 weeks to June 20th. This comes as the COVID-19 pandemic shows no signs of easing less than 2 months before the Summer Olympics open. The state of emergency in the capital and 8 other prefectures had been scheduled to end on May 31st, and Japan has seen a record number of COVID-19 patients in critical condition in recent days, and on Friday, Tokyo reported 614 new cases. In Africa, Namibia has recently reported a rebound on the number of COVID-19 infection cases, putting its medical system under heavier burden.
We are experiencing a higher number of hospitalization. In other words, patients who have contracted COVID-19, they need to be hospitalized.
Well, don't forget to protect yourself. The virus is still out there, so continue to take responsibility and visit our websites, channelstv.com, for more updates and a better understanding of the pandemic. We also have all the big stories for you, from politics to business, sports, and so much more, all at your fingertips. Well, that's the COVID-19 update. Thank you for watching. I'm Kayode Okikule.